This is Damian McNamara, Global Medical News Network, and with me is Dr. Henry Lim, who's chair of the Department of Dermatology at Henry Ford Hospital in Detroit. Dr. Lim, thank you for being with me.
Thank you, Damian.
I appreciate it. Now, we're here at the American Academy of Dermatology annual meeting, and you moderated a session earlier today where you spoke about advances in photomedicine, a number of speakers. One that really stuck out for me was Dr. Harvey Liu of the University of British Columbia.
Correct.
And he raised an interesting question about how much attention dermatologists spend on focus on UV light and some infrared light when there is some evidence about visible light being of danger in terms of skin exposure.
Correct.
And here we are sitting indoors in a visible light
Right.
situation. I'm trying not to panic. Could you tell me a little bit more?
Sure. Actually, the work that he cited came from our department. That work is primarily looking at the effect of visible light on the skin. You're absolutely right that up to now, most of the focus has been on ultraviolet light. That is what we use for phototherapy purposes. That's what we know it would cause sunburn as well as photoaging changes on the skin. Visible light up to this time has been considered to be a relatively biologically inert, that is, not causing significant response. So right now we do not know whether it is harmful or helpful, but we do know that visible light can cause pigmentary changes on the skin, especially in individuals who have darker skin color, what we call skin type 3 to skin type 6 individuals. So these are individuals who are darker skin color. When we expose them to visible light, there was a very noticeable and very distinct pigmentary alteration, essentially a tanning response that can occur in this individual. In that particular study, we compared the effect of visible light with the effect of ultraviolet A1, which is the longest spectrum ultraviolet A light. What we found is that the pigmentation caused by visible light tend to last longer and also has slight redness surrounding it, especially in the very beginning. That study is going to be published in Journal of Investigative Dermatology, has been accepted recently.
Okay, so are there any clinical implications? I know it's early in the phase, but if you're a practicing dermatologist, is there anything that you need to tell your patients?
Well, the clinical implication of that is that potentially in condition where there is significant changes on the skin pigmentation, for example, melasma, which is what's known as the mask of pregnancy. A lot of time it occurs in women when they're pregnant, or even if they take birth control pills and they have hormonal changes causing this pigmentary alteration on the cheeks. It is possible that visible light is playing a role in making the pigmentation to be persistent, in making the pigmentation to be darker. That goes along with our clinical impression that sunscreen in these individuals, it doesn't help all the time. And it is possible that the ultraviolet light plays a role, but visible light also is playing an additional role in making this color to be persistent there. So I think the implication on that is that if indeed that is correct, then we need to develop a filter, a sunscreen that can absorb visible light, and which is not an easy thing to do.
Okay. This has been Damian McNamara for Global Medical News Network.